It certainly can play a role. I mean, I think most of the studies in clinical studies in Alzheimer's disease, because of the issue that some patients, even in the early stages, are actually not aware to the extent of their deficit, we always, both clinically and in trials, require a collateral source to provide information about the person. Certainly early on, patients can make very rational decisions. But as the disease gets further along, it's harder. So you do need a collateral source and potentially somebody who has durable power of attorney, so they can make the best decisions possible for that person. Oh, it's critical, especially for a disease like this. Both for education, so they understand what's going on. Sometimes the person who's the caregiver can be under incredible stress. So there's different strategies you can use to try to help that, whether it be respite or counseling with a social worker who knows a lot about this, so they can really try to train the person as to how to best handle the patient. Even now, without let's say a medical treatment to do anything obvious that's proven, there are a lot of things you can do about it, for one, but I don't know what everybody's strategy is in this scenario, but I sort of look at this like any other medical disease, and I really carefully explain in layman's terms what's actually going on in the brain to the family, so that they understand the science underlying the problem. If I was treating a person who had lung cancer, and I was an oncologist, I would explain exactly what's going on to the patient and the family so that they know all the options for treatment. Well, it's no different for Alzheimer's disease. It's a disease of the brain, so you really need to explain exactly what's going on as best you know.